What's up, everybody? It's Dr. Michael Hyland with Hyland Physical Therapy and Wellness. It's Wellness Wednesday, which means it's time to look at, today we're continuing the series on self-treating low back pain, and this is Gettin to the Core Part 3. So we've done 3 weeks now showing different aspects of core strengthening or stabilization of the low back. So that's what we're going to continue to do today. And today I'm going to show you a couple of advanced versions of exercises I showed you last week. But last week we covered using an exercise ball to support your middle while you do some core strengthening exercises. Excuse me. It's a really good way to start because often you're not really ready, especially after back injury, you're not really ready to do a lot of advanced core exercises, and frankly it can be super weak when you start, or maybe it's been weak for a long time and that's why you had a back injury. Whoa, imagine that. Okay, so today we're going to look at those, and I'm going to kind of tell you what take we're going to do in the next week. Okay, so I'm going to adjust your camera, my camera, adjust your view a little bit, and so you can see on the floor here. Let's see. Whoop, that's a little too low. Let's see. Well, I guess it wasn't. I was just standing in the way. Nobody needs to see that part of me. Okay, so these are the same exercises we did with the ball last week, but you're going to see why the ball might be important. Okay, so I'm going to get so you can see all of me. Now, the ball helps to maintain a relatively neutral position of your middle, okay? So without that, you're relying purely on muscle strength. And that's where the rubber meets the road, because that's really where you want to get to, but you may not start out that way, okay? But on the ball, we started with either a single leg or a single arm lift, okay? So that's a good early exercise to do without support in the middle, because most people can handle that. At least it's still hard for a lot of people, so don't get me wrong. But so you're going to kind of gently pull that belly button towards your backbone, so you're kind of pulling this in solid. And then while you do that, you just do an arm lift and lower, and switch and lower. I forgot to say, before you do these lifts, I want you to notice my back position. So I'm not sway back like this, okay, doing arm lifts. That's basically not doing much. And I'm also not rounded. I'm finding my pelvic neutral position, or my back in a lumbar neutral, pelvic neutral. So for me, that's about here. So it's kind of not rounded either. It's kind of almost flat, right? So I'm going to hold that position while I pull in that transverse abdominis muscle contraction, and that's what I'm going to be holding as I do my lifts. So you notice my back isn't moving, even though I'm putting that kind of a rotating force there through my body. Now, the legs are harder typically, so I recommend starting with the arms. Then keep that pelvic neutral position, and then you want to lift a leg back, then lift the other leg straight back, and lift the other leg straight back, and so forth. You might rotate just a little bit with this. What you don't want to see is kind of that drop off. And that's where you really need that ball to support you. Is if you're dropping off, you probably aren't quite strong enough yet to do this without support. Now, the ultimate test of stability on this exercise is to do opposite arm and leg at the same time. So, pelvic neutral, pull that belly button back towards your spine to get that transverse abdominis and lumbar multifidus kicked in. That's your built-in back brace. And then you're going to hold that, and then opposite arm and leg. And then switch. And then switch. And then switch. Now I make this look easy. I haven't had a back injury, okay? So if you're doing this and you feel pain, you feel discomfort, muscle strain, anything like that, stop immediately, because it's probably just a sign that you're not quite ready for this stage of core strengthening. And there's many, many ways to address core strengthening. But here's the thing. Everything I'm showing you is a good way to get started, but it's not everything, okay? That's why I'm a physical therapist. That's why I have a doctorate degree to teach people to do this stuff. Because you have to adapt it to the person, and not every person's the same. Not every person's back injury is the same. So that's where my call to action to you is, if you have problems with back pain, try these exercises. But if you have questions or other additional problems, and frankly, I can almost guarantee you will. Although most of what I'm showing you will get you well on the way to recovery, even if it's just a couple of different types of exercises to try for mobility and core strengthening and so forth. But please, if you have questions or you know somebody that needs help, doesn't really know where to get started, please have them contact me by direct messenger or email or even call. But if I don't know you, you may not want to call me right away. So, but anyway, just consider that. And those two exercises are the ones or the two types of exercises today are what we're going to do for getting to the core part 3. Next week, what we're going to do is we're going to take this to the next step. So let's say that you've done all this stuff and you're ready to really get into almost like a work hardening kind of thing. Not work, but you get, you're trying to prevent injury and get hardened and kind of prevent that future problem. So that's what we're going to cover in the next week or two. I don't know how many weeks I'm going to do this, but probably at least another 2 weeks. And we'll go into that next. So next week, be prepared to look for 2 exercises, 1 or 2 things I'm going to show you on exercises that may seem crazy, outlandish, maybe, but it's worth it. So to kind of go toward that next step. All right, again, please like and share this video with anybody that you know that could benefit from this. And I know that you know somebody that has back pain, because who doesn't? And if and have people, especially if you're in Oklahoma, have people reach out to me. I'm more than happy to answer questions, and I'm just going to help give you advice. That's really all I want to do, is help people. So appreciate anybody who watched live. I saw a couple people flash by, and whoever's on Team Replay, comment #Team Replay. And I will see you next week for Wellness Wednesday. As always, be empowered.